For a long time, the Strategic National Stockpile has really sat in the background. A lot of people don't know a lot about us. We've been called everything from the secret squirrel to the man in black to everything else. We take care of assuring that the government is prepared to support our citizens in the event of any chemical, biological, radiological, nuclear event that might require medical countermeasures to make sure everybody stays safe. We hold a variety of medical items and pharmaceuticals. We have respirators, we have ventilators, and we have other medical devices. We've got a number of other antibiotics, antitoxins, and other material that we know that we would need if there was a really bad day in the country.
The Strategic National Stockpile is full of paradox. We want to never use it, but when we need to use it, we want it to seem like we've been using it every single day. It needs to work seamlessly.
We've deployed to a number of different events. In 2009, we responded to H1N1. We've also been engaged in responding to emerging infectious disease. We worked with the supply chain partners that we have to make sure that there was personal protective equipment available where it needed to be, when it needed to be, while still creating a stock of our own during the Ebola crisis. We've also been engaged in the Zika response that CDC has been leading for the federal government. We have to stay on top of a lot of information about where things are. We've got to make sure that we comply with all the FDA regulations, all the labeled indications for use. We have to make sure that storage conditions are appropriate, but that's not all. We got to stay ready.
Greg has been an extraordinary leader of this precious national resource. He brought extraordinary expertise from other government agencies. He'd worked at FEMA, he'd worked at GSA, and he brought some of their best practices to our public health mission.
It's just a really cool job. We've got a great opportunity to have a particularly profound impact on the nation's public health if we ever have to do what we have to do. I don't know anywhere else that you can do something where you feel like you have the opportunity to give so much back to other citizens of the United States.